Welcome to Mental Health Reality. Today we're going to talk about proposed federal legislation about mental health that's coming up in 2016. I'm your host, Ann Casper. We have two guests. Our first guest is Megan Kahe. She's a designer of peer support programs, a person with lived experience, mental health experience, and anything else you'd like to say?
I'm Senior Director for Peer and Wellness Services at Cascadia Behavioral Health Care in Portland, Oregon.
Okay. And Reverend Luke Walters, he is also in wellness support and the founder of Wellness Initiative Network. Anything else, Luke?
I identify in the recovery movement as a survivor, and that means that I've lived in institutions and with mental health services and grown to find a way of life that is balanced, stable, wellness on the other side of the experience. I'm proof that recovery works.
We're going to talk about language first before we talk about the legislation. Megan, can you mention about that language?
Sure, I'd love to. And first let me say thank you for doing this, Anne. We're really happy and excited that you're bringing a spotlight onto this really important topic. So with language, in the legislation we're going to be discussing, the term mental illness is pervasive throughout the legislation. And some of us, or many of us that have mental health issues, prefer to say mental health issues rather than mental illness. A lot of people still use the term mental illness, and that's kind of the common understanding. But to say persons with lived experience or with mental health issues or mental health challenges reflects something aside from the medical definition of what's going on with people having crises and other ways of experiencing the consensual reality, really. So I certainly prefer to say mental health challenges or mental health issues. Also, it's more recovery oriented. You know, it doesn't say that I'm a sick person that needs to be fixed. It's more that I'm someone who's having a very human experience that many people have at different times of their lives.
And both of you have mentioned recovery. Can you talk about recovery, what recovery means for mental health?
I see that it's very important in the process. The medical model approach to giving medications to reduce risk and to bring people into stable consciousness is really effective in the short term, but recovery is about learning about what in our life and our choices and our lifestyles brought the conditions on in the first place. So the recovery process and journey is learning how to become responsible for ourselves.
Megan, did you want to add anything else?
Well, we talk about the medical model, and in the medical model we're looking at doctors and the medical system to kind of fix a defect that we have. And that's kind of, I believe, an erroneous view. And that was the pervasive view for a lot of modern psychiatry and modern treatment. And then something called recovery model came along, and recovery was a term that was borrowed from addictions and from alcohol and substance use treatment, where people would recover something in their lives that they had lost because of the issues they were going through, the problems in their lives. I myself prefer to say well-being.
Okay.
Yeah, I'll use the word recovery. I actually like the term uncovery because rather than, I didn't really have something in my life that I was trying to pull back or recover.
All right.
I was needing to uncover the inherent layers of the deep goodness, of the deep wholeness that the medical model would instead try to deny.
All right. So let's go back to the legislation. Can you give us some background of what's going on today? Why is this legislation coming up?
Sure. It seems like every time you look at the news, there's another mass shooting. And certainly in 2012, there was a huge tragedy known as the Sandy Hook Massacre, or the Sandy Hook shooting. I think that affected everyone who remembers that happening. There was a congressman, or there is a congressman, Tim Murphy, and he was very effective. He's actually a psychologist. And in 2000, so Sandy Hook happened in 2012, and then in 2013, Congressman Murphy started working to introduce a piece of legislation called Helping Families in Mental Health Crisis,
Okay.
which we tend to call the Murphy Bill, but it's also House HR 2646. But we usually will just say the Murphy Bill. But it's about helping families that are going through mental health recovery or that want to help their kids to get into recovery, but they don't know what to do.
Okay. So this bill has been going on for a while then?
Yes.
Since a couple of years. And has there been changes to it?
There have been many changes. Earlier in November 2015, there was a markup. So it's been in the committee, let's see, I believe it's the Energy and Commerce Committee of the House of Representatives. And they came up with some amendments for it, but it's been going under different evolutions, but it's still very problematic. There have been a lot of advocates that have been trying to influence and shape the bill, but we still feel like there's some significant aspects of it that are not really going to help things if they become legislation.
What are the main topics or themes of the bill?
Well, the bill is like 153 pages long, so it covers a lot. And I just want to say, starting off, that Congressman Murphy and the people that have worked on this bill, that are proponents of this bill, have good intentions. They're not trying to take our privacy away. They're really trying to reform a system that we know is very problematic. And so I just wanted to say at the outset that I really am happy that people are looking at reforming mental health in our country, because it's desperately needed. We just want it to be reformed in a way that will actually change the trajectory of people going through the mental health system, so that people are not hurt, but people are actually healed. So parts of the bill, there are a lot of criticisms, and I can speak to the criticisms. One is that Sandy Hook was an awful experience for our country, as well as the people that went through it. And kind of the premise that the legislation is based on is that people with mental illness or mental health issues are violent.
Is that true?
Well, we know that people with mental health issues are no more violent than the rest of the general population. And what we have found, and what studies show, is that people with mental health issues or mental illness tend to be more often victims of violence, and really a more successful predictor of violence is going to be poverty, substance use, having a gun, but not having a mental health diagnosis. That's not a good predictor.
Oh, really?
Yeah.
Okay.
And a lot of people just don't understand that, because in our media and in the news and everything, it's like people say, oh, well, there's a shooting. Did they have a mental health diagnosis?
Right.
Yeah,
that's the first thing, isn't it? And how is the Pacific Northwest involved in this legislation?
Well, a number of ways. I think I mentioned earlier that it was being heard in the Energy and Commerce Committee, in the subcommittee. And part of that committee is our own Representative Kurt Schrader. And he's certainly someone to reach out to in terms of if people have thoughts or feelings about this bill. He would be a good person to reach out to, since we're basically his constituents. Also, kind of another thought is that Oregon has been going through, for the last number of years, a settlement process with the Department of Justice. And that started out with the Oregon State Hospital, and then the Department of Justice broadened the investigation to all of Oregon to see, are there community services that are adequate for people that are suffering with mental health issues.
So this is the federal Department of Justice, right?
Yes.
So they came into Oregon.
Yes,
and,
yes. There's this, and this has been a really big deal for Oregon. If Oregon did not address the things that the federal Department of Justice was saying were problems, we could lose control of the state hospital.
Really, that could
Yeah.
go to the federal government.
Yeah,
and like
yeah, and that
being
would
an
be
Oregon
a
state.
huge thing.
Yes.
But part of there's a piece of legislation called the Olmsted decision, and the Olmsted decision comes from another federal bill that was taken to the Supreme Court, and the outcome of that was that people that have either disabilities or that can be institutionalized for different reasons, they have to receive services in the least restrictive setting. So it had to do with a couple women in Georgia who believed that they could get services outside the hospital and live a better life. So the reason I bring this in is because the HR 2646,
The Murphy bill.
the Murphy bill,
Yes.
yes, would make it so that money, well, what goes with Medicaid. Medicaid right now will not pay for facilities that are larger than 16 people.
Okay.
And so this bill would make it so that Medicaid would pay for like state hospitals and for big institutions. And at first we say, well, that would be money going into a good cause because we need those beds. People need places to go.
Yes.
But what it really would mean is that money that could be used in communities for community care would get siphoned off to the big box institutions, which would not really be very helpful.
Right. And something that both of you brought up in discussions before today had to do with privacy and the bill. Can you speak to that, please? What does that mean?
HIPAA, the Health
Information.
Portability Accountability Act, is designed to protect people's confidential information, especially in the movement of information from one point to another, whereas how it is displaced and lost in many cases. So this is a very important part of the Murphy Bill because it'll allow family members to be able to talk to providers without the consent of their loved one, which
And why would that be so bad?
it could result in some loss of trust and splintering apart of families. And we're very concerned about that because recovery is part of support in a larger community, and keeping those families together is really an important piece.
And another point is that as it stands now, it is possible that if someone is having a mental health crisis and there's an emergency, families can be notified, and that's in the law right now. But what would happen is that people with mental health or psychiatric disabilities would have a whole different standard for their privacy than anyone else in our nation.
Wow.
Yeah. So
Different.
it would be like a whole different level of being a second citizen.
Exactly.
And can you speak to SAMHSA? What does SAMHSA stand for, and how is that related to the bill?
So SAMHSA is the Substance Abuse Mental Health Services Administration, and it is the biggest mental health organization that our government has. And it's under the Health and Human Services division. So SAMHSA does a lot of really great work in terms of supporting people who are dealing with lived experience. There's a lot of what we call peer support, and by peer support I mean that people who have an experience of mental health issues or mental illness themselves are able to undergo training and become providers of support for other people who are struggling.
Like counselors? Is that what it's
Well,
like?
it's not exactly like counselors. They do some service, so oftentimes they'll work in tandem with counselors, but it's really a more equal kind of thing. There's no hierarchy. It's person to person, or people like to say peer to peer, but it's a very even playing ground. And oftentimes, a counselor will say, they'll have ethics that will say that they cannot disclose their own personal information with someone that they're working with. But a peer provider, or peer wellness specialist, or peer support specialist often will use their own experience of the mental health system and getting through that system, like Luke was saying that he's gone through that system into recovery, that they'll use their own recovery as a way to give hope and to really connect with people that otherwise might be very distrustful and not be able to connect with other providers in the system.
And the federal government is supporting this then?
Well, in the bill there's mention of peer support,
Yes.
but when they talk about dismantling SAMHSA,
Okay.
it really would be most likely that peer supports would go away or be greatly reduced.
Well, how is that? How would that
Well,
happen?
if you read the bill, you'll notice that it says over and over psychiatry and then psychosocial supports and then pharmaceuticals. And the whole bill has we go back to language, is really a very medically oriented bill. And peer supports are not medically oriented. You know, in the programs that I work in, we will work sometimes in a medical setting, and we're not antithetical towards medicine or even pharmaceuticals at times, because a lot of us have experiences with both of those and they haven't all been bad. Some of us have been helped. But it's just...
For example, I think the Cascadia Walk-In Clinic also has peer services as well as medical help. Is that correct?
Well, at Cascadia, where I work,
Yes.
we have a very robust and vibrant peer support or peer wellness program, and there's the urgent walk-in clinic where we do have peer providers working. We have peer wellness specialists working to help people get housing, to help people make the transition from jail to being in the community. We have people working at what we call the outpatient clinics or the community wellness centers. We just have a broad array of peer services.
So if people need urgent help, where do they go and what time is it open?
Well, if you're in Portland or the Tri-County area, we can access the urgent walk-in clinic, and that is in southeast Portland, and it's open every day of the week, and I think it's open like from 7 or 8 to 11 at night. I can't remember the exact hours, but
It's
that's
on 43rd Division, right?
Yes, it is.
Okay.
Southeast.
Yeah, Southeast 43rd Division. And to get back to the bill that we're talking about, you had mentioned about the PAMI Council. What is PAMI and how would the bill affect that?
Another big area of the Murphy bill is proposing to reduce the funding to the Protection and Advocacy for Individuals with Mental Illness program, which is very old, started in the 70s, and it would basically reduce the ability for PAMI advocates and the Disability Rights Network from being able to advocate for people and protect civil rights to just being able to legally represent in cases like Olmstead decision, forced medication.
Okay, so what do you mean by legally represent? So if someone's in the hospital, they can get representation then? Okay.
That's right, but it would prohibit them from actually advocating and going above and beyond.
And as I understand that this is available in all 50 states of the United States, right? That's
Yes.
part of the...
It's a federal
Nationwide.
program.
Okay.
You know, part of what this really goes down to has to do with civil rights of people with psychiatric disabilities.
Okay.
That's right.
And you know, this bill would really erode the civil rights that people with psychiatric disabilities have. And you know, it would be a whole sector of our society. And we know that probably 1 in 5 people has a psychiatric disability or psychiatric issues or mental health issues, however you want to frame it. So that's a huge number of people
Yes,
that would
it
just be affected without civil rights protections.
Second-class citizens, again, as you
Yeah.
said earlier.
Right. And can you talk about institutionalization and hospitalization? That was part of the topics you had brought up before about this bill.
I don't think that we address that enough on the dismantling of SAMHSA piece, because SAMHSA funds a lot of the peer support and recovery programs around the nation, and what is proposed is to take the money that goes into those grants from SAMHSA and redistribute it into other programs, which is like funding the institutions so that Medicaid can be provided, and community services like assertive community treatment, which is outpatient, but it's still coercive.
It is. Okay, I've heard that works really well.
External locus of control influence or internal locus of control influence. Both are effective, but I believe coming back to the short-term and the long-term models collaborating together, we can open up and see how this can all work in a spirit of partnerships.
So if someone has a serious mental health issue or mental illness, and they're in, what's an ACT team exactly? What happens to them with that? You're talking about that.
They provide the services that people need, like medications, in the comfort of their own homes.
Okay.
So that they don't have to be institutionalized. It does save a lot of money. That's a big plus of the ACTs.
So at Cascadia, we do have peer providers, peer wellness specialists working with the ACT team and with the forensic ACT team. What is one thing about the House Bill 2646 is that it would have, let's see, it would be judge decreed outpatient treatment.
Judge decreed.
Well,
Okay.
People would be ordered by judges to be, it would be institutionalized, but within the community. It's it's a money saving thing, and it does keep people out of the big box hospitals. But people would not have very much freedom. They would be told where to live, what medications to take, who to associate with, and what's been found is that it doesn't really work. I mean, in North Carolina and I think New York, it was really shown that it was not as effective or no more effective than voluntary support that people get. They would look very similar.
What's voluntary support? I don't.
Well, people would say, I would like to have support in my home with my medication. I would like someone to come visit me every day and check on me and
I see it's
help
different
me
than
out.
having a judge tell you that you must do this.
Internal locus of control, again. The mandated stuff is external.
Yeah.
Okay. Is there anything else about the bill you want to mention before we talk about alternatives?
Can I get back to you if I think of something I want to mention?
Absolutely.
Thank you.
So anything else you'd like to mention? So Luke, you have some alternatives you'd like to speak about? Okay.
Yeah, what I didn't say on the collaboration between the different models is the short term could be seen as the medical model, which is very effective in helping people to become stable and more reduce risk, And then the recovery model can take in to account the learning about the issues that we have in our lives and taking responsibility. And then I believe that the long-term solution is the wellness model. Once we find out what we need in our lifestyle decisions and how to make a really sustainable way of happiness in our lives, that's going to serve people for the long term. It's going to avoid the side effects of long-term usage of medication and the coercive. I think that violence stems from having that external locus of control, just undermining our will so much,
So somebody else telling you what to do as opposed to you choosing.
And there's a reduced life expectancy from long-term medications also.
Reduce how many years?
Like on average 25 years less lived years. That's significant. I think that's a big concern for families. They might not know all this stuff. So this is a great opportunity for us to give a deeper glimpse into what this all means.
Okay. And yet, what does this mean for families if this doesn't pass? Is anything going to happen with the families?
Well, we know that this bill has a lot of support from family advocates right now in the National Alliance for Mental Illness, or NAMI, which has a lot to do with families that are needing support for their loved ones. So I don't think we should really talk about if in the short term the bill may or may not pass. I mean, Paul Ryan a couple of weeks ago, in the last 2 weeks, has said that it's a priority for him to make sure that this gets a vote and hopefully passes. That's his his idea. But what we know is that this is not going to really help the big picture of what's going on in our country with people that are suffering from mental health dilemmas. And so I think it would be very disappointing for families because they're going to find out that their loved ones are not going to be happier, are not going to flourish better. But we do need to keep looking for ways to improve things. And so the energy, the momentum can help with this bill, but needs to be directed. And also, people that have lived the experience of mental health issues and families need to have more of a role in creating the legislation itself. But politicians are not going to be experts for the most part on mental health or the systems that serve people. And so there needs to be much broader stakeholder participation.
So people with mental health issues and families working together to make some motions.
And with providers,
so all, everyone together. Yes. Luke, we have a short time. Can you mention a couple of these and then?
Yes, so this has really served to help us to unite more, the peer community, to realize that we can expand our ability to support each other and tighten our lines in the network.
So maybe one or two.
So in the Alternatives Conference this year, we decided to start moving on developing a bill also. It's probably going to take, a good year or 2 years to do that, but so far what we have is 10 alternatives points that represent a more wholesome solution to this, which appeal to the families and to the lawmakers. And this is working with a lot of different organizations and coalitions around the nation, united through the National Coalition for Mental Health Recovery.
So if someone wants to find out about it, they look under that, the National Coalition for Mental Health Recovery? Okay.
It's also a really good idea to send this, which is going to be a one-page JPEG, which is a picture file that can be widely distributed on social networking platforms.
So it's
very
called
simple.
10 Wholesome Alternatives. All right.
10 AltMurph for short.
All right. So we're running out of time. I'd just like to thank you very much for joining us today, Megan Kahe and Reverend Luke Walters. Thank you.
Thank you,
this
Ann.
has been Mental Health Reality. Thank you very much for joining us.
Thank you.
Yes.